Hi, everybody. It's Dr. Mildred, your board certified pediatrician and children's behavioral coach. I coach parents of children with challenging behaviors to better support and manage them. So today I'm here to talk with you guys about early diagnosis. Okay, so for all behavioral and sensory disorders, early diagnosis is best. Just like with any other disease process and a condition process like cancer or anything else, early detection, early treatment is the best option. Okay, let's talk about why. So let's talk about the different disorders that I'm talking about. Autism is one of them. Anything along the autism spectrum like Asperger's. Also attention deficit hyperactivity disorder, attention deficit disorder, also known as ADD, ADHD. Also ODD, which is oppositional defiant disorders. And then there are some sensory issues that kids can have that can also affect their behavior. So the earlier you get diagnosis, the more treatments and the better your children would do. So first of all, a lot of times parents are in denial about diagnosis. Everybody wants their child to be normal and those kinds of things. So it's a very emotional thing for most people to get any kind of diagnosis that means that your child is any different or unique than any other child, okay? But you can't look at it that way. Like I said, early diagnosis is better. Some children need occupational therapy, and occupational therapists often deal with the behaviors or activities of daily living, okay? Some children need physical therapy. That's more if they have any physical disabilities. Sometimes the sensory disorders require some physical therapy. Also, behavior therapy is something that's available for children with early diagnosis. Autism is a big one. So those kids oftentimes have issues with social interaction. So the earlier that they are introduced to social settings and get social interactions and somebody starts working with them early, they do much, much better. Same thing with Down syndrome. Oftentimes if they get early diagnosis, they can do better because of the therapies that they're offered. So you have to think, children are like little sponges, all right? So they absorb everything. So the earlier you start working with things and getting them help and getting them the information and somebody working with them, the better that they're going to do in the long run. So by denying it or not accepting what's going on can really negatively impact your child later and in the future. So like I said, nobody wants their child to be different than any other child, but that's just the way it is, just like in life, period. There are differences between children. Just because your child is unique doesn't make them any less or doesn't make anybody else's child any better. But we all want what's best for children. Me too, even though I don't have any at this point. But we all want what's best for children, okay? Especially parents. We want what's best for our children. And sometimes taking control and getting that diagnosis is what's going to be best for your child, okay? So just please keep an open mind. So if you have concerns, if you have an older child that developed more quickly, or you see difference between an older child and a younger child, and you see that something's not quite right, there is nothing wrong with going to the pediatrician's office or your PCP's office, primary care doctor's office, to ask questions. We do have testing that we can do for kids starting at certain ages to kind of give us an idea whether or not, a child is having difficulty, whether or not the diagnosis may be autism or ADHD. So there is some testing that's available. Sometimes some things we can do in our office. Other times we have to refer you out to see other people that can help us with the diagnosis. But I'm going to say it again, guys, it's so important if something's going on or if you have a concern to get your child checked out. If everything is good, no harm, no foul, nothing's needed, it's great. But if something's needed, the earlier that you start those services, the better. So let me give you some more examples. So sometimes kids with ADHD, oftentimes parents are in denial about that, especially with boys. Parents think, oh, boys are really active. And yes, boys are active, and some girls are just as active too, but boys are known to be active. Oh, he's just being a boy, that kind of thing. And that is true. But if you have a child that looks like they are running on a motor and nothing slows them down, they're not sleeping at night because they're always wound up and going and don't seem to be able to stop, that's not normal for a child, okay? If you have a child that won't make eye contact with anyone, that always wants to play by themselves, does repetitive things like constantly repeating things, what we call echolalia. If they line up things and they just have a fit, if you move one thing, then it destroys their whole world. Those things are not normal. Okay. So that could be your sign. Sometimes it's just subtle, simple things, but we as parents and as caregivers have to pay attention to those subtle things. And like I said, there's nothing wrong with just going and asking questions just to get the information to make sure that there's nothing wrong. And like I said, if there's nothing wrong, then great. And you can keep moving and that kind of thing. But if there is something, then if we can recommend that physical therapy or that occupational therapy or that behavioral therapy, your child is going to be so much better in the long run. You guys don't know how many times I have seen patients that a primary care doctor or pediatrician has recommended since the child was a year and a half or 2 years old that something may be wrong, and parents are in denial. They don't want to hear what we have to say, and they wait. Now the child is 5, 6 years old, not reaching any of the milestones, not talking like other kids their age, don't have the social interaction, they don't play with other kids, those kinds of things. And so we are 2-3 years behind the 8 ball in getting those therapies, and they are just not going to do as well. Now the therapies are still worth getting, no misunderstand me, I'm not saying don't get the therapies at that point, but the earlier would have been better if we would have got those therapies done. So early diagnosis is important. So if your primary care provider or if your pediatrician expresses some concerns about behavioral or sensory issues in your child, please let us make the referrals necessary and do the testing necessary to get that diagnosis so that we can offer what's best for your child and give them the best chance at success and their best potential. It's important because unfortunately as people, you know, you're not going to always be there, so you can't always take care of your child. So you have to make them be able to be able to take care of themselves as best as possible, or make it easy on somebody else if somebody else has to take care of them if it's something that's severe. Sometimes things are just mild, and sometimes therapy's almost 99% correct some things. So getting therapy is not a bad thing, and therapy for whatever kind of therapy, whether it be behavioral therapy, psychiatric therapy, you know, it's always been shunned upon, and people look at it negative, like, you know, something's wrong with you, but that is not true. So many people, even with mental health, we have to think about this, whether we're talking about children or adults, so many people with mental health issues will not go seek treatment because the stigma that goes along with it. So how many people are you getting that are committing suicide? How many kids and adolescents these days are committing suicide? A lot of times these things could be avoided if kids would get that help and could get somebody to talk to. So please, guys, do not be in denial if something is going on that concerns you or even concerns family members, because there's lots of people that family members have said something. Friends have said something to them about, you know, I think, and you know, it's always an emotional and a sensitive subject whenever you're talking about your children and something being different. So don't get upset and lash out at family and friends that are trying to bring something to your attention. As parents and as caregivers and people who love children, you don't want to think of anything negative or anything bad or anything's different, but sometimes things are different, and we have to be the responsible party and make sure the kids get the help that they need. So that goes even with mental health disorders. So as a society, we need to do better about not making it such a negative thing to have mental health disorders, because that's why we're getting all these shootings and these kind of things. People need help. They're lashing out. They're asking for help. And unfortunately, sometimes that asking for help is doing terrible things to other people. Okay, so that's kind of taking it to the extreme side. But just to give you an example how early treatment can help all kinds of things, not just children with behavioral disorders, but even mental health disorders in children and adults. So once again, early diagnosis of ADHD, ADD, ODD, sensory disorders, mental health disorders, all those things are going to be very, very important. Early diagnosis, early treatment is going to be best. So guys, please, I am asking you again, if you have any concerns, go see somebody and have your child evaluated. The earlier, the better. Once a child is 10, 12, 14 years old, it's very hard to go back. You can't get that time back. You can't get that time for therapy back. You can't get some of that back. You know, kids are most easy to alter things when they're younger. So the younger, the better. Same thing with your discipline and that kind of thing. It has to start early, okay? Things have to start early. You have to think, kids come here, they don't know right from wrong. It's our job to teach them right from wrong. So a lot of behavioral things, sometimes it is a true diagnosis and something's going on, even though we'll talk about later, sometimes I do think ADHD is overdiagnosed, and it's not always ADHD. Sometimes it's just a discipline issue. And that's one of the hard things about being a parent. Nobody wants to discipline, but unfortunately it is needed for our society. We all have to follow by rules, all of us. So we have to follow by rules as an adult. When do you think we learned that? We learn those things as children. So you have to set rules, and you have to stick to the rules and be consistent, like I've talked about previously. So life is about order. Children need order. Chaos is not something that they do well in. And unfortunately, if you let it go to a certain point, it's very hard to pull those kids back in and get them under control. So the earlier you start teaching small things. Yes, no hitting, small things. Just start to teach small things. So what things seem small to you are big, can become big life lessons for kids later. You know, the habits that you have as a child, oftentimes we take them into adulthood, right? So listening to your mom, saying yes ma'am or no ma'am if that's what you do. When mom says no, don't do that. That's another thing. Kids often get hurt because they don't listen. You know, they don't have that disciplinary structure. So you tell your child, no, don't do that. They go and do it anyway, don't listen to you. Kids often get hurt. They get hit by cars, they get into accidents, they climb on something they shouldn't be. And kids are going to be kids. And of course, sometimes they're going to do things even when you tell them no. But the better discipline and the better structure that you provide for your children, the less likely those accidents and your children is blatantly not listening to you will happen. So early diagnosis, early therapies, okay, are going to be what's needed. So let me say hi to everybody. Thank you guys so much for coming and listening. If you have any questions, as usual, I can answer questions now. Also, you can leave questions in the chat. If you have any questions, I'll give a couple of minutes to see if anybody has any questions. Hi, Brandy. Hi, Chris. Hi, Dr. Zarina. Hi, Dr. Dietrich. How you guys doing? Hi, Miss Russo. Hi, Jackie. Hi, everybody. It's so good to see you guys. Thank you so much for joining me. So next week, we will talk about a different behavioral topic. I'm not going to tell you what it is. I'm going to make you wait and see exactly what we will be talking about. But hopefully you guys are getting something from this. And even if it's not your child we're talking about, you can, send somebody my video. If you think their child is having something going on and you want a soft way to approach it, or then please, this may not be about your child. It may be about a child that you know, a family member, a niece, a nephew, a cousin that you may have concerns about, and you may need a little help to hi Paxton, how are you, my sweet boy? Hi Roxanne, I miss you, Paxton. Thank you for coming and seeing me. It's so good to see you guys. All right. So anyway, I'm going to get out of here, guys. You guys know who I am. I'm Dr. Mildred. Please connect with me across social media at Dr. Mildred Peds. That's Dr. Dr. Mildred, Mildred Peds, Peds, across all social media. Your kids deserve it. Connect with me. Thanks, guys.